Alrighty, thank you, Rachel. It is time for our Health Watch, and as always, we are joined by our friend, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
Glad to have you back this week. So we have a couple of talkers. First up, we're going to talk about UV light. Now, there is some research out that says it can kill airborne allergens. So how does that work, and would it be beneficial to folks who suffer from severe allergies?
Yeah, let's talk a little bit about this. So ultraviolet, just to take a step back, ultraviolet rays light is actually used currently on a commercial scale, airports, hospitals, to disinfect equipment for its antimicrobial properties. So this study looked at what would it entail bringing this technology at the home level, and will it be safe? Does it really make a difference? So ultraviolet rays, can be harmful. So less bandwidth UV lamps were used, and basically what the study found was allergens that can come from cats or dust that may trigger allergy symptoms, whether it's difficulty breathing, itchy skin, or runny eyes. All of that can be prevented because there was a decrease in number of allergens in the air when ultraviolet rays were used. And the basic premise here is the proteins that may trigger some of these allergy-related symptoms, they change how they are configured because of the effect of UV rays. So which means when the body takes them in, it doesn't recognize them as allergens. So it won't trigger those symptoms. Now, more research is needed just to make sure, things are safe and protection isn't needed, because we know the harmful effects of UV rays as well. So, but this is promising though, because remember, per the CDC, Symphony, 1 in 3 adults and children suffer from allergies in this country.
Yeah, I know mine tends to pick up during certain times of the year.
Right.
I've been sneezing a little more in recent weeks.
Right. It's the season.
Yeah, 'tis the season. All right. Up next, there's some new breakthrough research on strengthening bones and how that relates to possibly reversing osteoporosis.
Yeah. So in a nutshell, this is an interesting study done in mice. Not in humans yet, but what they looked at was researchers looked at a specific receptor that is linked to bone strength, bone density, formation of new bone. By osteoblasts. And when this was triggered, it reversed some of the symptoms or some of the pathogenesis behind osteoporosis. So promising. More research obviously is needed, and more so in the human side of things, but the same mechanism, more or less, same process is probably playing out in humans. So a promising new modality to look into for the future.
Awesome, awesome. Okay, now this last one I found to be pretty interesting. We always rather talk about how oral health is important. We hope you brush your teeth morning and night.
That's right.
But it turns out it can also trigger Parkinson's disease, according to some research.
Yeah, let's talk about this. So there's been literature out there on the gut microbiome and its link to Parkinson's disease. But this study in particular looked at, okay, so what does the microbiome consist of in patients who do suffer from Parkinson's disease? And one bug stood out, Streptococcus mutans, which is basically an oral bacteria that is notorious for causing dental caries. But in patients with Parkinson's, the gut had a large degree of Streptococcus mutans. And then this bacteria releases some metabolites which then go to the brain and cause death of certain brain cells that are implicated in Parkinson's disease. So again, this was all done in mice, but it is a very, very interesting study, and more, of course, research is needed to see, are there other things we can do to prevent this disease from happening?
Yeah, so good oral care is not just about having pearly whites,
Right.
straight teeth. There are some other links.
Other benefits too.
All right.
Potentially.
Yes, potentially. Yes. Thank you so much for joining us.
Thanks for having me.